Hi, this is Drew with the McCormick Agency of Healthcare Solutions team. I'm here with your health insurance tip of the week. My hope is that I'm going to start creating these weekly videos to hopefully expand, some of the knowledge about health insurance and give you some tips that might help. So, what I wanted to talk about today was one of the most, common questions that I get is, what is an HMO and what is a PPO? What are the differences? And there are quite a few differences. So let's start off with a PPO plan, which a PPO plan is really, in my opinion, the best of the best. It basically allows you to choose just about what any doctor you want to, in most cases across the country, provided that they're in the network. And depending on the network, some are better than others, but for the most part, PPOs are generally going to be your best option. Because it does give you a lot more flexibility as far as choice of doctor. Now, with any health insurance plan, you always want to make sure that the doctor is in network, because when you go out of network, the prices to go out of network get a lot more expensive. The deductibles get significantly higher. Coinsurance amounts go significantly higher. The out-of-pocket limits go significantly higher. In some cases, there's no out-of-pocket limits when you go out of network. So with any health insurance plan, your best bet is always to stay in network. So that's a PPO. Now, an HMO is another aspect or type of plan that you can get, which, in my opinion, isn't necessarily a better option, but it can be a more affordable option. Big difference with an HMO versus a PPO is that with an HMO, you're going to be assigned a primary care doctor, and that's kind of your go-to doctor, so to speak, as far as for just basic services. Now, anything that doctor can't or doesn't treat can go to a specialist. Now, the big difference is with a PPO, you can go directly to that specialist, provided that they're in the network. With an HMO, you actually have to get a referral from your primary care doctor to see that specialist. So that's the big difference, is that you can't necessarily see whatever doctor you want to with an HMO. You have to get referrals in order to do so. So that is a big difference. Not to mention, when you travel, an HMO is not as good when you travel. In most cases, you're not covered when you leave your home state. So that's where, if you have an HMO plan, make sure you have supplemental coverage to help plug in that hole. So when you travel, you're still covered. So hopefully these videos are going to be brief and can help teach you something. If you have any questions, feel free to make a comment or shoot me a message. I'm happy to help. Thanks.